I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I am thrilled to welcome back Dr. Dennis Kivlighan, a world authority on group psychotherapy. In our conversation, we discuss using actor-partner models to understand group dynamics, the role of engagement in group behavior, the surprising therapeutic value of group conflict, how Dr. Kivlighan would run groups if he was the all-powerful group psychotherapy czar, and much more. And please feel free to leave a comment below. And if you enjoy this conversation, it'd be appreciated if you hit the like button and subscribe to the channel. This episode starts with Dr. Kivlighan talking about actor-partner models of group psychotherapy. Let's jump in.
That model, you can think of the actors as the sort of the individual influence, and then the partners as the group influence. They are as a group affecting how I interact in that group. And so when we look at that, so for instance, I can't remember that article. I was writing about sort of some of the summary of our research. But so, for instance, we can look at how engaged I think the group is as an actor, and then we can look at how engaged my partners think the group is, and then we can compare that. So, and we can compare that in terms of my intimate behaviors in the group. So if I feel like the group is more engaged, am I going to have more intimate behaviors in the group? If my partners feel like the group is more engaged, am I going to have more intimate behaviors in the group? And when we look at that, when we do the statistical model, what we find on average is that the partner's perception of engagement is about six times more important to predicting my behavior than my own perception of engagement.
Can you say that one more time, slightly differently?
I know. So I think the best way to think about it is that the partners represent the group.
So thinking about if I, Dan, am in the group with you and Jill and a handful of other people, the partner are for Dan, they're you and Jill and the other people.
Yes.
But for you, right, for Dennis, then for you, the group is Jill, Dan, and the other people. So the group is different for each member because it doesn't include you and it does include everyone else.
Right, exactly. The group is different for each member because the group acts on you. You can't act. You are acting on yourself as an actor effect. You shouldn't also be part of the partner effect.
Right.
And most group research conflates that. The actor both has an individual effect, but they're also part of the group effect, and that would be like, having a test with, looking at an item on a test, and then individually, but also including that item as part of the test. Yes, how you said it is right. So each of us has a different group that we interact with. The partners are different for each of us.
And so say the same thing about the 6 times more important.
Okay, so think of what those partners are. So the partners. So we're asking. All of us are saying, how engaged do we think the group is? Each of us are filling out a questionnaire on engagement.
And so that's just like how much they're like they're with us. They're in the moment with us. They're paying attention. They're in the soup with us.
Yeah. Mm-hmm. Yeah. So, I fill it out myself in that, I bring my own perceptions and biases, and that. So my my perception of how engaged the group is uh, has some. We'll be statistical here for a minute. It has some true score in it, and it also has some error in it. Now, my partners, when we average them, just like whenever you make a composite, whenever you make an average, they they are going to get closer to the reality of how engaged the group is. They're they're going to the average of the partner scores is going to have more truth to it and less error than any individual's score. It's going to have more error and less truth. And so what we're getting when the partners give us, when we're looking at the partner scores, we're getting an idea of what the group is really like. How engaged is the group? Because we'll use the group term consensual validation. We've got a consensus of what the group is like. And that consensus of what the group is like is a better predictor of what I'm going to do than my own perception of what the group is like.
So, how engaged the group is, how engaged the other group members are, is more predictive of what I'm going to do in the group than my own perception of engagement in the group.
Mm-hmm. I know, it blew my mind. I thought, oh, the first time we did this and we found that it was the partner scores were more predictive. It was like, oh no, this is just an artifact. Something's going on. And then we did it over and over again, and we always found the partners were more predictive. It's like, wow.
So
There's
part of the
power of the group.
Right. So part of the way that you make sense of that is that because of in the aggregate, it's just more accurate. There's more true score in there. Are there other less methodological ways that you make sense of that?
Oh yeah, because that those it is it's that whole notion of the sum is bigger than the sum of the parts. The whole is bigger than the sum of the parts. That the power of the group is that coming together. It's not just scores on an inventory. They are the members of the group are consensually validating everything that's happening in the group. I mean, it's this is just a abstraction of what goes on in good group therapy all the time, which is that we always are seeking consensual validation. We're not just, that's one of the things that really makes groups effective is we have that more objective reality that the group can give us that we can't get on our own. And we get it from the measures that we get, but we also get it the measures are just a reflection of what's happening in the actual group.
And when you say consensual validation, what do you mean?
Consensual validation is the notion that none of us can know reality by ourselves, but if all of us together put the piece of reality that we know together, we can get closer at the truth. So we look for a consensus that will give us a validation of what the truth is. The truth may be what I'm doing. I think I know what I'm doing, but I may have some blind spots. And if we just have one person saying, oh, this is what you're really doing, well, this is how you're really acting, they might have some blind spots too. But if we ask that same question of 5 other people, and we worked in the place that we get some consensus on what I'm doing, that's going to be closer to the truth than any one of us could have gotten to on our own.
Right. And so in one way, therapeutically, that's one of the benefits of group as well, is that you're able, right, you have the mechanism, if you will, to be able to do that, to give back to other group members this, no. I understand that's what you're thinking, but this is what's actually happening, because you're able to get that from the other group members.
Mm-hmm. Yeah, in individual therapy, we hope and we train the therapists to be able to give, sort of objective feedback to the clients, but it's never going to be perfect. It's never going to be it's never going to be the same thing as in the group where we can get a consensus on that feedback.
Right. Huh.
That consensus is always going to be more accurate than any one person's, no matter how well trained and no matter how self-aware I am as a therapist. I'm never going to be able to reach that same level of understanding that a consensus of people can reach.
Right. So you mentioned engagement. And so you've done some work looking at how groups develop over time. And you've done some work sort of looking at, so there's one project in particular I was sort of dug into a little bit, looking at like group engagement and group conflict simultaneously. And you found some maybe for the average listener, not intuitive things in terms of the role of these things and how they relate to each other. I'm wondering if you could talk about that a little bit.
Well, it's so, most theories of, if you look at stage theories of group development, there've been, like everybody has their own stage theory of group development. And it's been a long time ago now, but Tuckman looked across a number of different models and came up with that forming, storming, norming, performing notion of how groups move through time. And then Tuckman and Jensen relooked at that again several years later and added adjourning. So a consensus model of forming, storming, norming, forming,
Performing.
storming, norming, performing, adjourning. So there's always been the notion that conflict is an important piece of groups. And the whole notion of group development is that there's important learning that's taking place in those different stages. It's not just, you're not just getting through that storming stage. You're learning how to have disagreements with other people and learning ways to, fight fairly, to be in conflict and to use conflict to enhance relationships, not hurt them. So it's that storming phase has important learning around the notion of conflict. So we've always had this notion that learning about conflict, but a lot of the research is doesn't necessarily, or how to say it, a lot of the research suggests that conflict is not good, that conflict is leads to poorer group processes, to worse outcome. And it Jennifer Johnson wrote an article where she summarized a good bit of research looking at conflict And I think the title was something like "Beware of Conflict." And her bottom line takeaway is conflict is always bad. That at least in the research that we've seen is that it's related to less helpful outcomes. Uh, and I think that was sort of an art. And as we started to look at the research, we think that there's several problems with that research that would lead you that. I mean, her conclusion was exactly right. I mean, if you based on the research she was looking at, that you would say let's not have conflict in our groups because. But I think that there were problems with that research that led her to that conclusion. A lot of the research was done at the individual level rather than the group level. A lot of the research didn't look longitudinally, didn't with just a one-time snapshot of what was going on in the group. And so I don't think the research didn't match the theory, the stage theory. And so what we were trying to do was to get at to do our research that was more consistent with the theory. And what we found was that if I'm thinking of the right study, I think I know the one you were looking at. Is we used a measure that had looked at engagement and conflict. We looked at it 3 points at time, so a beginning, a middle, and end. And what we found was that if there was conflict that was more than usual, so it doesn't have to be a lot of conflict, but if you look at the average amount of conflict in the group and compare the group to itself, so some groups might have relatively high conflict, some groups might have relatively low. But the key is that during the middle stage, if the conflict is higher than usual, then that pattern of conflict development is related to better group member outcome. So it is both looking at and we looked at it at the group level. So it's the conflict in the group as a whole, and then the relative nature. So you compare the group to itself rather than comparing across groups. And when you do those two things, then you see that actually conflict can be helpful if it's occurring at the right time and if it is in the right relative amount.
I think that relates also back to what you were saying earlier. I'm linking it when you're talking about these trying out new ways of being, that having some of that, like within the group, having some friction is some of that feedback of this person said this way or did this way, and it sort of rubbed some of the members of the group the right way. And instead of just being polite and cordial and letting it go, that there was a bit of a pushback, right? That there was a appropriate amount of conflict that they said, that they barked back at the person, but or they, maybe, optimistically said, when you said that really hurt me. It really made me feel whatever. And that created tension. And that's where those corrective experiences, at least some of them, are.
And anger has an important role in life. It can be destructive if it's too big or at inappropriate times. But anger is how we protect ourselves. It's anger is related to boundary crossing. It's like, if you cross my boundaries, I'm going to say stop. Don't do that. And so if people will be in big trouble in the real world if they can't do that. They can't protect their boundaries, if they can't tell people to stop when they need them to stop. And so group isn't going to be as effective if they don't get a chance to learn that as much as, learning to be able to say I care about you in an appropriate situation. Those you need the opportunity to learn both how to protect yourself and how to make yourself vulnerable.
So one of the other things I want to hit on, I feel like we need to get out of this conversation because of your particular expertise, is talking about group variability, sort of member variability. And so we can go any way you want, but just to sort of set you up here, and then we can sort of decide the springboard you want to take. So in the same article I quoted from earlier, you also wrote that practitioners should examine measures of dispersion and uniformity to gain a better understanding of the dynamics in their group. And that also sort of talks about what we're talking about now with group conflict. But I guess whether you want to talk about that specifically or thinking about group member variability generally, I'd really love to hear your thoughts.
It's so interesting. So, my son is a counseling psychologist also, and he studies group therapy like I do. It's kind of been amazing to have. So I've actually published with both of my kids. My daughter, who's the older, is a school counselor, and we've published together, and my son, who's a counseling psychologist, we've published together, and so we've done this. It's been amazing to be able to share that type of experience. But so when I was first learning this actor partner model, Martin was just in his doctoral program. And so, he was pretty young in thinking about both therapy and in thinking about statistics. And I was, going on and on about, this actor partner model is so amazing. And so, you get the actor and then you get the mean of the partner scores, and you look at that. And he said, Dad, why the mean? Why are you doing the mean? And I was like, shut up. What do you know? You questioning me? And it took me a little bit to appreciate his wisdom, but we're fascinated in with the mean. I mean, we give a test, we get the mean of the items, we get the partner scores, we get the mean of the partner scores. But if you go back to just basic statistics, you learn that I think there are 4 moments of a distribution. There's a mean, a standard deviation, skewness, and kurtosis. Well, if you want to describe a distribution, you really need to think about all 4 of those things, right? So why have we just gotten fixated on the mean, and not I'm not saying that the mean's not important. It is important, but why are we throwing away this other information or ignoring this other information that we could get from a set of scores? And so that's what I was trying to say in that article, was that you've got a lot more information there if you've got a partner effect, for instance, or if you've got information about the group. You've got a lot more information than just the average level. And if everybody is saying that the group is really engaged, if you've got a high mean and a narrow standard deviation, that's really different than if you've got a large. If you mean, you could have a mean, for instance, you could have 2 groups with a mean of 4 in terms of the level of engagement, and one of them could have a standard deviation of 0.1, and one could have a standard deviation of 2. Now, are those two means telling you the same thing?
Right.
No, no, they're not telling you the same thing. And to, plug them into our statistics as if those were equivalent, if those two means were equivalent pieces of information, is really misleading. And so we've got to get beyond, from a statistical point, we've got to get beyond just our obsession with the mean. But if you're looking at, if you're a practitioner and you're giving a group climate measure to your group, or any type of measure, any type of feedback informed therapy, is don't just add it up and get a mean, or don't just sum it and look at the distribution of scores. Look at why, and try to understand, what's going on and I'm going to keep it to the group right now. What's going on if there's a group that everybody is saying the same thing versus a group where you're getting a mean because everybody is saying something different? Those are telling you something really different about your group, and where the group is. And I mean, and it's not necessarily good or bad. I mean, you could have a lot of consensus and it could be good, or you could have a lot of consensus and it could be bad. It could be, collusion to not want to do the hard things, or sort of like a pseudo engagement rather than a real engagement. So it doesn't necessarily mean that consensus is good, but consensus is telling you something that that is important to know in addition to the mean, whether it's high or low.
And I'm thinking that while we're talking about like models and sort of statistical models and things like that, I'm also thinking about how the models are almost reflective of sort of the point of view of the group leader, the group therapist, that so for example, when I teach, right, I kind of tend to, I pay attention to the individuals, of course, but now that the semester's over, I sort of think about like the group as a whole. Oh, that was a really great group. They were super engaged. Or other times where it's like, that group, they were just really, every time I came in, they were sort of lethargic. They didn't have a lot of energy. They weren't into it, right? So I sort of think in some ways, not always, but there is sort of this tendency to think like the mean, right? That's the mean. Mm-hmm. But that like, rather than that, to think about, thinking about so thinking about that as a group leader, thinking about the variability in your group and trying to conceptualize it that way, but then also getting back to the actor partner models, thinking about, okay, what is it like for Julie? Like, how does Julie experience this group? Because I, as leader, I mean, right, we all have a first person point of view. So I see the group as the average of these people, but she sees the group as the average of us, and he sees the group as the average of us. So I think, and I hadn't really thought about it before, that these kind of your methodological approaches, there could be value in the therapist trying to take those points of view, the same points of view as your methods are taking, to get a better sense of the group, the dispersion, the variability within the group, and then also the perspective of each member of the group.
Yes, I really love what you're saying, because I think that we limit it if we only think of methods as helping us to answer questions, because methods can also tell us what questions to ask. And if we don't know the method, we can't ask the question. And so I think that they play a much larger role than they're often given credit for, because they help us think about what's going on in different ways than we may have. And the example you brought up is a great one. If we only think about the mean, if our if the method that we have in our mind is just the average, that's going to limit us in terms of really understanding what's going on in our group. Then if we sort of have the idea, that what's affects it is the average and the standard deviation. And actually there's some research that says that skewness and kurtosis also matter, that it not only matters what the dispersion is, but what the dispersion looks like. That that they can give you you can get some information, for instance, about subgrouping from measures of skewness and kurtosis. That whether or not you have subgroups within your groups.
And by subgroups, you mean?
Well, like like that groups that sort of have developed sort of their own way of seeing things or doing things, and they sort of fall together. So like you could have a subgroup of people who are more you could have like a subgroup that's more pro therapy, and a group that's more anti-therapy, that are sort of trying to block things from happening. So a group that's pro taking risks, and a group that's anti-taking risks, and you can sort of identify who's in those two groups, and you can identify if those groups exist, and if they do, then you can identify who's in those groups, and then
Right. Yeah, and that really. Sorry, go ahead.
No, it just gives you some more power in terms of trying to intervene in your group.
Right, and I was thinking that really, like, at the beginning of this conversation, when you talked about how the methods are allowing us to see these incredibly complex phenomena, right? And that in group, obviously, that is going to happen sometimes, maybe often, where you are going to get, clusters of people that are going to be really pushing things forward, and other people are going to be, you could have, like, it could be everybody but one person, or it could be a couple of groups of 2 or 3 or whatever, and how that, and for those of us who have, been in groups or in any number of roles, like that obviously happens. Mm-hmm. And so being able to model that. One of the questions, so I think that one of the criticisms of group, largely speaking or broadly speaking, is that kind of the impracticality of it, or the challenges of it. And I guess, having been at various places working clinically, that you see that you see people who are motivated. Oh yeah, let's get a group going. And then, a few weeks into it, they have 2 people or 3 people or whatever it happens to be. And so it's challenging. So I was wondering if you could speak to your thoughts about that, and even any strategies or approaches that you've seen that are effective for sort of dealing with some of those real world challenges.
Well, I think actually the world is getting friendlier to group in many ways. If you look at counseling centers, many counseling centers nowadays, they're getting really very short-term treatment models. 6 sessions, 4 sessions. They've become in many ways just referral, assess and referral, and therapy or treatment has sort of gone out the window. But I think that many of them actually, they don't have the same time limits on group. So in some ways, group can become your primary treatment. modality. That uh, if if someone does need more extensive therapy, that they should be referred to group. And I think I think um, I think counseling centers have made a huge mistake in sort of going all in with the I don't know what to call them, these group models where they're doing these uh, theme oriented groups. You know, if I was in charge of the world, there would be open ended groups. There'd be that, that basically that individual therapy would be either for very short term um, stabilizing, or 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 for for some people that's plenty of treatment. That's all they
Yeah.
need
Yeah.
is 6 sessions. That's fine. But if someone needs more than 6 sessions, they should be going into an ongoing therapy group. And if you have open-ended ongoing therapy groups, the hardest work in doing group therapy is getting the group off the ground and setting the norms.
Absolutely.
Once once you get the norm set in the group runs itself in many
Right.
ways. Why are you restarting the group every semester and having to do that hard work again? Just do open-ended groups, and the group members will train each other in the culture.
So so we have our Tuesday from 1 o'clock to 2:30 group, and it just runs every week except for the 4 weeks in August when the center's closed. I'm making that up, but whatever.
Yes.
And the we're always going to have between 6 and 8 clients. Does that sound a reasonable number
Yep.
ish? Okay.
Yep.
And
My
so
superstitious number is 7.
7. Okay. Okay. There we go. There you go. So if there could be a wait list for it or whatever, and that when somebody, I don't want to say drops out. It could be terminates, right? That there's
Yeah.
an end, right? For any number of reasons,
Yes.
that the next person pops in to get that, to try to get that magic 7 or whatever, and that it just runs in perpetuity, and that this semester you and I are leading it, but next semester I have another thing, so another co-therapist comes in and you and she lead it, and it just keeps going.
Mm-hmm.
Huh. Huh. And so because I didn't expect you to say this, which is that you would not have special topics groups. I don't know what you want to call them. Can you just, because I think the majority of groups are like, if we would do
I think
like
so too.
yeah. Okay. And so can you just, I have an intuition, but can you say just a little more about that? Because I think that people who are listening, that's not what you said, is very antagonistic to what they typically do and experience. And I think it's worth taking a moment.
Yeah, I think so too. It's certainly outside of the zeitgeist of the current zeitgeist is what I'm advocating. The the I think the reason that people started doing theme oriented groups, it's sort of easy to get people into them. It's as a if I know that there's a grief group, if I know there's a depression group, if I know there's an eating disorder group, when I'm doing intake, I just have to listen for, oh, does this person have an eating disorder? Oh, I can refer. It's easy to get into. Um, the uh, in all theme groups, those all the theme groups typically tend to be fairly short term, fairly they don't often take advantage of the group dynamics. I mean, some of them do.
Right.
Some of them are really good, but many of them are psychoeducational rather than more process oriented, more here and now oriented. And and this is my bias. I'm just a big believer in the power uh, of that here and now experience in terms of transforming people's lives. And so I think that I would rather see group time devoted to having those, giving people those type of experiences rather than doing more psychoeducation in groups. And if you're not trying to do psychoeducation in groups, trying to do a short-term process-oriented theme group where like I said, all the work is up front, where you're setting norms, and then to lose all that work at the end of the semester is just, to me, silly. Why start over next semester and do all that work again?
Yeah, and I think in the context of university counseling centers, what you're saying, it couldn't be more correct based on my personal experience, which is, you start the semester and it's not until, a couple weeks into the semester, the group actually gets started, but then do you have enough referrals to even get it started? And it's kind of like pushing a big rock that's not completely round. It's really hard. And, at some point you might just hit a flat spot and just forget it. We're done. This isn't going to work. And it often feels like the majority of them and it's nothing, it's not a criticism in any way of the therapists who have been doing it. It's just how it's set up. So this, I haven't thought about it very much, but what you're saying actually it feels right intuitively without having thought about it very much. And is I think it's, that you sort of making me think.
Oh, good.
Yeah. So broadly speaking, and I ask this of everyone, which is, have you gotten any pushback for your work?
I'm just always amazed when someone actually reads my work.
Yeah.
It's, I don't think I've gotten any pushback. I love it when someone would take some of the conclusions that we've made and try to say that, I feel like I do that a lot. I say that, well, I don't think you really got the right answer because you didn't, because of the way you looked at it. And I would love it if someone, did that with the things that we are doing. And I would learn so much from that if, someone comes along and says, well, they're asking an important question, but there's a better way to do it. Or they're asking an important question, but I don't think they really got at it with the way they did it. The honest answer to that is there's not much group research happening. There's not enough of that. I think that if you look at individual therapy and all the studies that have been done on the working alliance and how people have, sort of made arguments about the alliance and what it is or it isn't about the alliance that's important. And I think that's been great for the research. I think it's been great for practice to, get different perspectives on how we really should be thinking about the alliance and how we should be measuring it. And if I wish we had more of that in group therapy. I wish that there were enough group researchers out there doing that would be pushing back on each other. I think that would make our research better. There just isn't enough of us out there doing it. It's hard to do. It's hard to get, it's hard to get a sufficient sample size in groups where you can really do that.
And then the last thing is, for people who are listening who would want to learn more about your work or are there one or two resources that you would point people to. And I'll link the couple of articles that we've talked about.
It's not specifically about group therapy, but it's my favorite article that I've ever written. Mark Hilsenroth, when he was editing Psychotherapy, he asked a number of different people to write articles about. I don't remember exactly what it was. It was about 3 things that they wanted to happen in each session. And I wrote mine as I don't make much distinction between individual and group therapy. I actually think I'm doing interpersonal therapy in individual and group therapy. I'm doing the same thing. It's just easier to do in the group because I've got help. But the 3 things that I want to happen in every session is the same in individual therapy and group therapy. Those are the things that I think make a difference. And so that's probably the one article that and it's more practice oriented.
Right.
It's not, it's more sort of this is given the research that I've done in my years of practicing, this is sort of what I've come up with.
Thanks so much for watching. And if you found this video helpful, please like it and subscribe to the channel. I'll see you in the next video where we continue exploring the science of psychotherapy and applied psychology.